should also be able to have some contact with the dispensing facility, and they can make a quick phone call so that you can clarify. And especially if maybe you're just starting out medication, this is not somebody who's been on regular follow-up for a while, so that all of us are on the same page in terms of the patient, the clinician, hopefully their family members, and the pharmacy itself. Now, with regards to this being restricted to confined spaces, remember, we appreciate that also within the context of normal life, people do negotiate personal spaces. So this is not necessarily completely new, but what is new is this confined spaces that people are being restricted to, much more so within their houses or well, within workspaces if they are. And when you go there, you have to have all this appropriate distancing between them. Now, if you're a person who what this does, it disrupts our daily routines. And there are patients who do get disturbed when their daily routines are disrupted. And these include persons with intellectual disabilities, especially the young, but definitely many other people as well. And this actually also may provoke, trigger, lead to various fears being enhanced, various paranoid ideations being enhanced. And we have to keep this in our minds as we're interacting with our patients. Disruption of our daily routines again, increase in anxiety disorders, which we will experience. And this has been, for the practitioners, they've been able to see this. There's the issue of washing hands, for example, the unseen threats. COVID-19 virus is here and there, and whatever it is, we don't know about it. And so there's, like as we indicated before, a rise in fears and anxieties, fear and paranoia, fear and persecution. And so all these kind of delusions and ideas will become increased in this particular period, so to speak. Our living arrangements, sometimes the way we live is to ensure that we give each other space. But when this is now destabilized, again, this is triggers for disruption of various mental health control that one may have achieved in the past. This need to be able to keep clean all the time, wash hands. Those who have issues with obsessive compulsive behavior or ideation, once again, something that can actually provoke or increase this kind of symptomatology. So these are the kind of things we want to keep in mind as we are providing care. And this has been appreciated around the world. There has been an increase in symptomatology. There has been an increase in mental health concerns. Dr. Jackie has also mentioned the issue of alcohol abuse, which is really, really big and seems to be increasing. And it's one of those things that we need to be able to look at. When you look at also these actual measures, here we are, we're wearing masks. But wearing masks may be interpreted as trying to hide identity. Once again, within the context of managing somebody with paranoia, it's a challenging thing, and the need therefore for family members and for practitioners and any form of person who interacts with a person with mental health concerns to be able to keep this in mind as you're working with them. I've already mentioned the issue to do with obsessive compulsive thoughts with regard to hand washing, physical distances. There are those who find people encroaching on their personal space extremely threatening. And here we are, we're being confined to these particular purposes, confined spaces. So these are things that we need to be able to appreciate. We do know, and there's a lot of evidence now around the world, that infection with this SARS-CoV-2 has been associated with strokes, seizures, mental confusion, which I've to some degree just described. And it's also associated with visual and auditory hallucinations, depression, manic disorders. And so these are things that we have to keep in mind. Once again, we need to be able to acknowledge that we may have comorbidities and they will need to be treated. And again, that has just been put across. So I just wanted to add those comments as perhaps maybe we can get into now any discussions.
Yeah, thank you, Dr. Bukusi, for bringing up those issues and letting us know the kind of considerations that went as you are making the document. We now want to open the session for question and answer. And I'll start with some of the questions in the chat box as I welcome Dr. Kalondu to take over. I'll also asking, I believe it's Lynette on the device indicated as nurses to be ready to ask your question, and Rosemary Wanjiko to be also ready to answer your question. But as they are preparing, there are two questions. There are several questions which have come up. One is, do we have numbers of patients who have mental health and who are also have tested positive for COVID? Do you have any numbers from our isolation centers, treatment centers, and also from Madare? Have you had a patient who is there and also has COVID? Jacqueline?
Maybe I'll speak for Madare. As far as the isolation treatment centers are concerned, we may need maybe some updates from those specific institutions. But as far as Madare Hospital is concerned, we've not had to treat any client who is COVID-19 positive. There were some suspect cases, about 1 or 2, who were sent to the hospital, and upon taking the necessary precautions and testing them, tested negative. And so we just continue to manage them just as any other patient, but we've not had any interactions as far as Madare Hospital is concerned.
Okay, thank you. We also have a question on you gave us the number of doctors and their distribution. In terms of the mental health nurses and clinicians, are we also having similarly low numbers? Do you have an idea of the kind of numbers we are talking about?
Unfortunately, I may not have. I may need to get that information maybe from the Director of Mental Health, especially regarding the distribution of maybe the psychiatric nurses and other mental health workers in the country. But what at least I know I'm sure of by virtue of being in the Kenya Psychiatric Association leadership is really the number of psychiatrists you have in the country.
Okay, thank you for that. There's also a question about sometimes in streets you see people with mental health problems who are walking around, and what are the measures that are being proposed for those kind of people? Or that group has not really been?
I know, those are some of the situations where they require emergency care. I know that it was unfortunate some time back when there were some videos doing rounds of some of our patients really found, in compromising situations in the streets. But what we've been able to do is at least to just organize for them to be brought to the Madari Hospital, the patient department, as we said, that the services are still being offered, but we all need to take the necessary precautions. And in that case, most of the times they are brought either by a Good Samaritan or by police, and we definitely can't send those away, so we take care of them accordingly.
Thank you for that answer and for that information. Rosemary? Oh, Dr. Bukusi, you want to add? Yes, before Rosemary, hold on for Dr. Bukusi to make a comment first.
All right, especially with regards to the patients who are on the road. I mean, in the past, and once again, this was a practice in the past, that there would be community social workers and the police who would actually, how shall I say, escort patients, people who seemed to be behaving abnormally on the street, to Madari Hospital, much more specifically, but sometimes also in Mombasa, to Portrees, and in various Ward 9s, as they used to be called in many of the provincial hospitals. And the police are actually quite involved in this. But this somehow seems to have dropped off. And it's one of those things that perhaps going forward, we really need to be able to develop strategies for, because the numbers are actually really going up. Thank you.
Yeah, thank you, Dr. Bukusi. Rosemary? You're unmuted. You can ask your question or make your comment. Okay. Nurses, are you able to make a comment? All right. Dr. Kalondu, you can take over.
Okay. Thank you very much, Dr. Kinuthia. Thank you, Dr. Jacqueline Acheng and Dr. Bukusi for the wonderful presentation. This topic came about after Dr. Cheng, you updated something last week during the session where a colleague asked about his son. So we appreciate that you updated that and you're able to pick it up. And I'm seeing the colleague has commented and he said, just to say thank you for my last week's question on management of mentally ill patients with COVID-19 disease is being addressed. And he's saying he's actually come across a patient who was a threat to others and to the staff while in isolation. Thank you, Michelle, for that. And I agree with you. It's good that we are starting to talk about this and we are starting to address this issue. It's about time that we did. So thank you, Michelle, for that. We acknowledge your comment and we appreciate that you brought that topic up. All right, so there's somebody who's asking about issue of documentation, especially for digital prescriptions. This is Joseph Omungala. And it's saying on documentation, most of digital prescriptions which we have received in pharmacy do not have the prescriber's details as required by the law. How can one balance between assisting the patient and the legal requirements for a prescription? I know that one will be for pharmacy, but for us at our end as the prescribers, how best can we provide all the details that are required for them to honor these digital prescriptions that we are providing as healthcare workers? Dr. Bukusi, how best can we address that?
Again, it's a very useful question. To some degree, it's already been addressed in the guidelines, where we have asked that medical practitioners really need to have their names very clearly, hopefully the institution they're working in, and their registration number, which should be on the prescription. And I'm hoping that would be able to meet the legal requirements. There's a telephone contact there, which would be able to, one would be able to trace the individual, especially the particular prescriber should the need arise. But this is definitely something that needs to be emphasized. I know there are many medical clinicians who sometimes try to help people while they're walking around, in a manner of speaking. And so we really need to emphasize the need to, especially within the context of having these kind of prescriptions, which have to be kept for record purposes, that they must put in place their legal requirements with regard to being a prescriber, so that everybody is responsible for whatever it is that they have done, either prescribing or dispensing. Thank you.
Thank you for that. I'd love to know from the pharmacists, are they in a position, you can just comment in the Q&A section, are you in a position to honor our digital prescriptions? Is it possible? I know there are a few apps that are doing that. There's MyDawa, and I'm sure there's another one. So are you in a position to honor that if we start this system? But I'm sure it's possible and something can be done about it. I'm seeing Lynette is also bringing out the same issue about online dispensation of prescriptions. So thank you for that. Career Raymond, unfortunately, we will not address your staff, your question today. You're asking about pharmacy department and how many staff are eligible to work in the COVID-19 center. That the team today is addressing mental health issues. So thank you for your question. We will, when we have the pharmacists on board, we'll be able to put that up and get their feedback. Dr. Cheng, this is to you, and somebody is asking the precaution measures. Maybe you addressed this in your presentation, but somebody is just seeking clarification, precaution measures to put in place to safeguard the health of patients in Mathare Hospital, at the Mathare Hospital. So have we been able to put any measures? Have we reduced our number of patients? Are there, I know for social distance, it might be a challenge because I know you carry with the bulk of the patients, the mental health patients in the country. So are there any measures maybe you've been able to put in place to protect the staff and also the patients?
Okay, maybe from what I'd shared, and as far as Mathare Hospital is concerned, okay, first of all, we know that the restrictions that have been made, then Mathare being a national referral hospital, we used to get so many patients coming in from different parts of the country. So unless it's absolutely necessary, inpatient admission has been reduced to a bare minimum. And for the and we also identified like 2 specific wards, male and female ward, for the new admissions. And that in itself offers protection for those who have been in the existing wards previously. And as we said, we have to keep monitoring them in case any symptoms come up and transfer accordingly. As far as, yeah, I think the first thing that I need to mention is that even when we're coming into the hospital section, we have a screening done for everyone, whether you're a patient, a staff, or a visitor. And so that in itself also offers some bit of protection for the patients that are within the hospital and also for the staff working within the facility. Indeed, as far as numbers are concerned, we know that it's been a period of 3 months. Of course, the patients who are within the hospital, once they recover, they are discharged and they go home. And so we may not necessarily have the crowd in quotes as it used to be before. And we hope that as time goes by, then we're able to maintain this. And given that we need to empower the counties to be able to take care of the patients that are coming within their institutions so that not everyone flocks Mathare.
Thank you, Jackie, for that response. And I like that last statement where you're saying you're empowering the counties to be able to manage patients from where they are and not transfer them to Mathare. So thank you for that. I can see this issue of digital prescriptions has piqued our interest a lot. So we will see whether to have a session on that, what PPB would advise and how we can go about it, because I agree with the guidelines and I agree with the protocol that has been developed. Some of these things, you might just need to refill a prescription. The patient does not necessarily have to see you. And those are some of the things that we need to look into. So thank you, Winnie, for your comments. We will look into getting members of the PPB to come and have a discussion on digital prescriptions and how you can account for them in pharmacy. But if you do have any suggestions on how best that can be done, please let us know so that as somebody's prescribing, anybody who's listening to this session, if they decide to prescribe for their patient is still able to get their medication without any difficulties. Joshua Kali, thank you for your question. He's talking about travel restrictions and they've affected drug-dependent psychiatric patients. And especially the ones who the facility next to them does not have the drug, does not have the medication. And Joshua, I think that's where the issue of online prescriptions will come about, but maybe Dr. Bukus, you can highlight to us how best we can create systems to enable such patients receive their medication. If the online service is not available in the county they are in, how do we best help these patients get their drugs? Do we have a network that can do that?
Well, in response to that, I guess part of it is going to be about the initiative of the patient, the clinician, and the pharmacist. And if in a given area one knows what kind of drugs are available at the different kind of pharmacies, then they can communicate with them and create a network. And this is actually one of the things that is being encouraged. Within the context of counties or particular localities, get to know who are the providers of various services, both the mental health and the clinician, the pharmacy services, and what kind of medications are actually available. And as we are still trying to streamline this issue of online medication and treatment and management, including presentation of prescriptions, perhaps at this point it might not hurt too much to make a phone call to the provider. And the presumption is that whoever it is that's prescribing has a phone contact. And so one can actually call back. I know that Nairobi Hospital, for example, have a delivery service. I'm not sure which other hospital. There's some hospitals which have delivery services right now. And that this may be a possibility. And some pharmacies also have delivery services of medications. So depending on what medication one needs, then whichever pharmacy can provide that particular medication can be explored, and then the medication can actually be delivered to a place where a patient can pick up that particular medication. I hope that answers the question, Dr. Karen.
Yes, thank you. Thank you so much for that response, Dr. Bukusi, and I agree with you. Patient initiative, Joshua, or the patient initiative, as Dr. Bukusi has said, the first sentence he said, is very important. So if you know of any patient who's on long-term medication, it doesn't have to be a medication for psychiatric illness, any other illness, please urge them to try and get that medication and also the facility. So that patient initiative is very, very important. I'm not seeing, there's a question from Joseph, and Joseph Ndwati, I'd like to park your question until tomorrow. You're asking about medics who have come into contact with COVID-19 positive patient and denied quarantine. They are on duty as usual. Let me park that question until tomorrow. If you can see our topic for tomorrow, we'll be talking about health worker well-being, mental health, and burnout. So part of that is being addressed in the well-being. We will be able to ask the team that is handling tomorrow's session, how best do we handle this? Today, we are focusing more on the guidelines that have been developed, but we appreciate your question and we take it into account. Thank you for that question. There's somebody who's offering and asking whether, Mora is asking whether medical students and psychology students, despite having lack of experience, can get involved in the online psychosocial support. I'd like to ask Dr. Bukusi and Dr. Cheng, what do you think about that? Is it possible for anyone to just do psychosocial support? Or do we have to have at least some basics on how to handle situations when we come across them?
Okay, if I may, and I hope Dr. Mudoni is on the line, Manai, on the call. I know that she was developing an initiative, of course, on supporting some of our students to actually provide the services. So, but it's important to appreciate that not just everybody should provide the services. Clearly, no, they have to have the capacity. And in order to have that capacity, they have to be taken through thorough training so that they can then help in the provision of services under supervision. And so there'll be, it will be a regular, it will be a well-structured monitoring and evaluation, well, capacity building in the first place, then monitoring and evaluation of actually how well the service is being delivered. So yes, we can make use of them, but in those particular conditions and not just because somebody feels they are led to provide services. Thank you.
Okay, thank you for that response, and I agree with you. It's best that we have at least some form of qualifications or a way of addressing it, some skill in addressing it. We're seeing quite a lot of influencers, for lack of a better term, let me call them influencers on social media, all talking about mental health and offering advice. And the general public is picking that up, but I really wish they'd be able to also invite an expert on that field to join them in their discussion so that they can be able to offer a comprehensive topic, not a one-sided opinion of what they think the patient should do or what they think the listener should do. So thank you for that. Peter Kiara, I see your hand is raised. Kindly unmute yourself and you can ask your question. Hello, Peter. Okay. Okay, Peter, we can't be able to unmute you from our end, but I hope your question has been addressed. If you're not able to unmute yourself, you can just type it in the Q&A section and we'll be able to address it. Thank you for that. So thank you for attending today's sessions. It was very educative. We've learned a lot from Dr. Ocheng and Dr. Bukusi. I believe most of your concerns have been addressed. The concern that is coming out about the online prescription, digital prescription, it's something that we will follow up and probably invite a team to come and take us through that, how best to do it. So it is very good that that topic and that discussion has started. Yes, so thank you so much for that. And thank you to the participants. I'd like to invite Dr. Bukusi and Dr. Cheng to give us their parting shots, maybe their words that they'd like to, their last, their parting shot, not their last words. They'll probably have many other words after this, but their last words before we end this session. Yes, Dr. Bukusi, we can start with you.
Yes, I hope to have a lot more words as time continues. Yes, but extremely important, ladies and gentlemen, all those who are participating. We do have these guidelines. They are available, as has been indicated. They're out there. Mental health is a big problem, and it's growing, and much more so, especially in these confined periods of time. We need to have a high index of suspicion. The good thing is the guidelines are available. Let's see if we can develop structures and networks around where we actually function and operate so that we can actually help provide services for those who have mental health concerns. Again, as you appreciate, we did give a brief in this particular document indicating what mental health teams should comprise, and it should hopefully, I mean, it's literally at facility level to begin with, let alone and then growing outside the facility and into right up to the community, or rather the county kind of health facilities. But within your locality, you may well have some other NGOs or other support organizations that you might also, other stakeholders that you might also be able to bring on board and have a planned response for mental health activities, and much more so, especially within the context of this COVID-19 pandemic. You may have appreciated, I think a couple of people have, there have been a couple of incidents where it has been said that some of the people who have been who have faced mob justice or even worse during this particular period have been people with mental health problems, and we need to be able to raise our index of suspicion to appreciate that when people are maybe seem to be flouting some of these rules, they may actually have an issue, and hopefully we'll have compassion in being able to address some of them. Thank you very much.
Yes, thank you, Dr. Bukusi, for your words of wisdom. I'd also like to just appreciate the KNH team for inviting me to share the information that we have in the mental health aspect, and also appreciate the great work that you have been doing throughout. I've been participating in most of the sessions. Of course, my interest was first in the mental health Wednesdays and Thursdays, but I realized that a lot of the information that you're sharing is cross-cutting, and we need to also be well-versed with information, all-rounded, really. And so we thank you so much, and we continue to look forward to other interactions and interesting topics that are coming up. Thank you.
Okay, thank you very much. Thank you. Thank you, Dr. Cheng. Thank you, Dr. Sorry, there's a bit of an echo. Okay. So thank you, Dr. Cheng. Thank you, Dr. Bukusi, for finding time for coming to update us our question, and I believe also Stephen's question has been addressed. Anybody who's listening to this session, now you know how best to manage our patients. I believe we've all learned something, and we can all pick something and implement it in our own small way in the facilities that we work in. And as Dr. Cheng has said, try your best to manage the patient at the facility where you are in. Mathare might not be in a position to carry all the patients in Kenya, especially in this era where we are expecting them to also adhere to social distance and put in measures to keep the patients safe. And I appreciate, Mathare, that so far you've been able to protect your patients. I mean, if we ever got an outbreak of COVID-19, I don't know how you'd be able to manage it, but we appreciate that you've been able to protect your patient, and I believe also your staff to a large extent, and kept them safe. Dr. Bukusi, thank you for always coming up. to our sessions and teaching us. Every time you attend these sessions, we learn something. And also, Jacqueline, we've learned so much from you. Tomorrow, we're still going to have mental health topic. We cannot exhaust mental health at all. It's too wide, and it's about time the healthcare worker also benefited from it. So tomorrow, we're going to talk about healthcare worker well-being, their mental health, and burnout. I know you feel like we've talked about burnout so many times, but it never gets old. And every time this topic happens, you learn something new. I learned something new, and I'm sure also the participants also learned something new. So we'll be hearing how some of the facilities out there have handled this case, how they've supported their healthcare workers, their staff, how they've made sure that their staff, despite handling huge number of patients, have been able to stay sane and fit during this period. So that will help you either at the county level, at the national level, and whichever level you're working in private sector or public, to be able to take care of your own well-being, to be able to address the issues of burnout. It will also be able to help you address, some of this information that you get is not just for your own use, but you can assist a client who will come to you at the pharmacy. Somebody who's buying medication, today you see them, they're complaining of headache, tomorrow they come, they're complaining of something else, next week again. It is a conversation that you can actually start at that small level and at that small scale, and bring it out and refer them to an expert or to a specialist, or guide them on where to get support. So thank you for attending this session. Kindly note, tomorrow's session is at night, 7 to 8:30 p.m. We won't have an afternoon session. And on Monday, we're also tackling something also closely related to mental health. If you see, we'll be talking about domestic and gender-based violence. There have been reports that there's been an increase of gender-based violence during this period and domestic violence. And it's all related to, we're assuming it is all related to our well-being, our mental well-being. So that is also related to that. So we'll be having a discussion on domestic and gender-based violence on Monday afternoon. So thank you so much for attending this session. Thank you to all the participants. The few comments about CPD, we are glad to get your feedback, especially the team from PPB. It would be good to get your feedback, whether your points are coming on time, and if they're not, we'll be able to find out. Mora Ataya, I'm seeing you're asking about what Professor Modoni is doing. We will find out if it's something that we are in a position to share. We will share with you. So thank you all. Have a good afternoon, and see you tomorrow. Bye.
Thank you.